Morning, everyone. Happy Monday. Thanks for joining us on Midwife Monday today. We're going to talk today about water breaking. What is this thing about water breaking? It's come up. It always comes up, actually. It's always a big topic, especially for first-time moms. There's a lot of anticipation about water breaking. There's a lot of misconception about water breaking. So we're going to try to just quickly in this Midwife Monday, just hit some really hot topics on it and try to dispel some myths about it. I'm going to really be talking in generalizations today. So of course it's general. A lot of this depends on where you're birthing, whom you're birthing with, what kind of providers you're with, your personal health history and things like that. So let's just start off with, how do you know if your water broke, right? So many people, we get so many phone calls throughout a woman's pregnancy, mostly at the end of, oh my gosh, I think my water broke. Oh my gosh, I think my water broke. Water breaking in general, right? For a full-term mom, that means someone who's 37 weeks or past that, with a head-down baby, right? A vertex baby, full-term, healthy mom, healthy baby. What we know is that when your water breaks, it's not subtle. It's not a little thing of like, oh my gosh, I think maybe there's a little bit of wet on my underwear. I think maybe my water broke. That's not how it works. It's significant. There's a significant amount of water that comes out, and it soaks through your clothes. It will splash on the floor, and not only will it do that one time, but it will continue to leak until your baby is born. It's not a one-time event. And it's not one of those things like, we get a lot of phone calls where moms will wake up in the middle of the night because they have to go pee, and they'll notice that their underwear are a little wet, and they're a little bit concerned. Oh my gosh, I think my water broke. That's not your water. There are a lot of things that come out of the vagina in pregnancy, which is kind of insane. But we have lots of, our cervical fluid changes throughout our pregnancy. And a lot of it depends on a variety of factors. Some women have more cervical fluid than others. Some women have more yeast than others. Yeast can be really copious, actually, at the end of a pregnancy. And you can have this liquid come out of your vagina that is kind of significant. It happens maybe once. It doesn't continue throughout the day. And it might even be so much that it soaks through your clothes, but it's only one time. So one thing about water is it should not have an odor, right? Having an odor to the amniotic fluid actually is a sign that perhaps there might be some kind of infection. But it's odorless. It doesn't have texture. It's not slimy. It's not mucousy. It's really just like water. It does not smell like urine. And we know, like this is a lot of people say, well, I don't know, it's either my water or I peed. Pretty sure you know if fluid comes out of your vagina or if it comes out of your urethra. I mean, we can pretty much identify where we pee from and our vagina. So I don't really think women can confuse water breaking with peeing, because pee comes out of your pee hole and water comes out of your vagina. So there's that. But water breaking, it has no color, it has no odor. It should not have a color. It should not have an odor. It doesn't have a texture. Sometimes if it is your water, it might be mixed with you might see some vernix in there, some little white specks in there. You might see some pink bloody discharge in there. That's all normal. It should not be green. It should not be brown. It should not have a bad, foul odor. Those are signs of concern. Those are definitely signs that you should call your healthcare provider, go to a local hospital, whatever it is, however you're choosing to birth your baby. But in general, it shouldn't have any of those colors, it shouldn't have odors, and it has no texture. So not to be confused with normal cervical fluid. The other thing is, what do you do if your water breaks? So it's not like in the movies where you see, I will never forget, I don't know what I was watching, but some like cop drama, and they're in court, and of course, the woman's water breaks, and then 5 minutes later she's like, ah, the baby's coming out, and she like falls on the floor in the courtroom and delivers a baby. That's not really how it works. I mean, I guess there are instances, depends on what number baby you're having, where you could break your water and then you would spontaneously go into labor and have the baby pretty quickly. But it is very unlikely, statistically improbable, that out of nowhere, you're at the grocery store, your water is going to break and the baby's going to fall out. It's generally not how it works. Usually you'll be having contractions, and the pressure from the contractions will cause the water to break, but you're already contracting, so you already know you're laboring, right? And then your water breaks, and then the contractions will maybe get more intense, because when the water breaks, the head may come down and apply more pressure to the cervix, which causes stronger contractions. Also, your water may never break, as a matter of fact. Your water does not have to break in order for you to have a baby. Mind blown, right? People think, how is that even possible? But we see it quite frequently, actually, at our birth center, because we don't artificially break the bag of water, right? We just let the body labor. If the water breaks, the water breaks. If it doesn't, we don't break it. So it's called being born in the caul. C-A-U-L is the word. And many babies in our practice are born in the caul. It's not as, well, people think it's super duper rare. It is super duper rare because the majority of women in the United States birth in the hospital. So you rarely will see a baby born in the caul because it's not the standard of care in the hospital. For a variety of reasons. It's just not how they operate in the hospital. Out of hospital, we see it quite frequently, actually, because we're not interrupting and we're not instigating the breaking of the bag of water. So the question is, though, if your water breaks, what do you do? Oh my gosh, your water broke, and you're not in labor yet. It's just your water broke, but you're not having contractions yet. So it just means your water broke, and within the next 24, 48, 72 hours, you will spontaneously go into labor. And so the question is, how long is it appropriate to wait until you go into labor? And big generalizations coming up here, okay? So there's a lot of evidence, there's a lot of research that's been done on this, and there's a lot of different protocols on this. And there are a lot of factors that come into play when we're deciding how long do we let a woman go before we kind of intervene and augment her labor pattern. The factors will include, is she full term? In our practice, of course, we will not catch a baby before 37 weeks because it's against our license and it's considered premature. So all of our babies, if your water breaks between 36 and 5 days, you can't have the baby here. We would say, let's go to the hospital and have a baby. But 37 weeks to 42 weeks is when we catch babies out of hospital in the state of California. If you're in a different state, different rules apply. But in the state of California, as licensed midwives, we catch babies between 37 and 42 weeks. So in between those times, your water breaks, you're full term. Great. So we're going to wait for your labor to start. Your group B strep status is known. You have consented to a culture, and we've identified whether you are positive or negative for group B strep. That's going to play into how long we want this labor to progress, or we want your water to be broken before we want labor to start. Is the fluid clear? Is no foul odor? Does the mom have a fever? Is the baby's heart rate good? There are so many factors. But what we know is that, and I'm going to read, we subscribe, we have a medical database. It's called Up to Date, which is all the current research that we subscribe to here at the birth center. And so all of our protocols here at the Santa Clarita Birth Center are evidence-based. We always check our research. We always want to make sure that what we're doing is appropriate and it's kind of a national standard. So what we know at the Santa Clarita Birth Center is that there is no strong data on which to base a recommendation for the maximum duration of expected management in women with no pregnancy complications warranting delivery, which means basically there's no good data to say everybody has to be delivered by 24 hours. Everybody has to be delivered by 8 hours. It really depends on the institution where you're delivering and what your provider's protocol is. Here at the birth center, we know that if you're GBS negative, you have no maternal fever, we have a baby that is in a head down position, we have reassuring heart rate, right? We've listened to the baby, we know the baby's sounding good, we have a compliant mama who can check her temperature at home, that knows the safety precautions that we're going to give her. we do what's called expectant management. And we know that spontaneous labor will happen 50% of the time. Within 5 hours of your water breaking, 50% of women will spontaneously go into labor. So chill, hang, give yourself a little bit of time. There's no emergency, given the fact that we have a healthy mother, a healthy baby, we have a head down position, we have a baby that's giving good fetal movement, right? There are criteria here. So I'm going to reiterate, red alert, generalization. So if you have a breech baby, you're 36 weeks, you have a fever, your fluid breaks and it's brown and stinky, you are not staying home. That's not a smart place for you to be. You're going to go into the hospital. But if you are between 37 and 42 weeks, you have a head down baby, your water breaks, it is clear, you are GBS negative, you're feeling your baby move, we know 50% of the time you will go into labor within 5 hours. 70% of the time you will go into labor within 24 hours. 85% of you will spontaneously go into labor without any need for medication within 48 hours. And 95% of you will go into labor within 72 hours. So there's this big window of time that you guys really have to make some decisions on how you want to proceed, and you want to have this conversation with your healthcare provider. You know, what's your protocol? What if my water breaks? These are conversations you can have with your care provider before this thing happens. Again, it's called informed decision making. Have a dialogue with your care provider. We talk about these things at the birth center. We upload these things into your chart. So we have an electronic health system, right, where everyone, we put a bunch of files in there. You can check what we talk about in our prenatal visits, all your labs are in there, and we put information in there so we can have conversations about what is the current standard of care in the United States, what is the research telling us. But we know that for most women, for 95% of women, they will spontaneously go into labor within 72 hours. Now the question is, should you wait that long? And that's really a conversation that you get to have with your provider to make those decisions. But again, they're all with a head down baby, no infection, baby sounds good, we have a reliable patient, we have assistance at home, we have dependable transportation. Obviously, if you are living in a location where you can't get to a facility where you're having your baby, or your midwives can't get to your home within a certain amount of time, these are all factors that are going to go into how you would move forward if your water breaks before labor. So remember, the water breaking is not subtle. It's a big event. It's a big giant gush of water. And it will continue, you will continue to leak until your baby is born. The head does apply and create like a cork. So it generally, when you move, you'll squat, you'll sit down to go pee, you'll stand up after peeing, you'll cough, you'll sneeze, you'll have a contraction, water gushes out. That's an indicator that your water's broken. There are also ways to confirm whether your water is broken, and these are things that we do here at the Santa Clarita Birth Center. So if you suspect that your water is broken and you're continuing to leak, we'll say, well, let's come on in. We're not going to do a vaginal exam, ideally, because we don't want to introduce bacteria, right, which increases the risk of infection. But what we might do is take a sterile Q-tip, right, a sterile swab, and get whatever, like, check whatever fluid is coming out of your vagina, and get it all on this sterile swab and put it on a slide and let it dry, and then we're going to look at it under a microscope. And we can see if it's amniotic fluid. It's called ferning. It's a ferning test, just like the little fern plants, right? Amniotic fluid has this crystallized appearance on a slide when we look at it under a microscope. Confirmation of water breaking. There are also some other factors that you can do, some other techniques. It's a sterile speculum exam. Nobody really likes that part, but you put a speculum in that vagina and you take a look at the cervix, you take a look and see if you see any fluid coming out of that cervix. That's a confirmation of water breaking. There's also something called nitrazine paper. We don't use that here at the birth center because a lot of times we'll get a false positive on that. So we like to do what's diagnostic. So we will do a ferning test to confirm that your water is indeed broken. And most of the time, it's not broken. Mm-hmm. Most of the time, women think that their water's broken. They come in, we put it on a slide, and there's no ferning. So don't assume it is your water. Always check with your care provider and be assessed if you think it is. So that's like the big generalization on water breaking. The concern is that the baby will become infected. The baby's no longer in a sterile environment. So those are all legitimate concerns. So it's very important that if your water is broken, that you don't put anything inside of your vagina. So limited vaginal exams, which one thing that's why it's important to have a conversation with your care provider. So if your water breaks and you're having a hospital delivery, the standard of care is to go into the hospital to be monitored and make sure, right, no fever, the baby's moving well, and all of those things. Totally appropriate if you're delivering in a hospital. You want to have that conversation with your care provider. What's the plan if my water breaks? When you birth out of hospital with us, as you call, we'll have you come in. We'll assess and confirm whether it is or not your water breaking. And then we will not do a vaginal exam, ideally, until we see that you're actually actively laboring. And we see that labor, there's some kind of labor pattern, so then perhaps we'll do a vaginal exam, but we try to not put anything inside your vagina. We also have a tool that we use here at the Santa Clarita Birth Center. It's called a neonatal sepsis calculator. And it is used in many hospitals in the United States. And we use it to identify, like, if your water is broken and you have all this criteria, we put our data into this calculator, and it will tell me what the risk factor is for an infection for your baby. And if any of this indicates that this baby's at a high risk for infection, we will not stay at the birth center. We're going to go in. We're not interested in having a sick baby here. So we're going to recommend, given the data we have, given the research that we're looking at, we're going to have a conversation about it and say, look, I put all this data in. It indicates to me that your baby's at a high risk for infection. Let's go to the hospital and have this baby. Let's keep the baby in the hospital for observation because we don't want this baby to get sick within 48 hours of delivery. But on the same hand, if we put all this information into our calculator and it tells me that we have a 0.05% chance risk of neonatal sepsis, then we know that this baby is very low risk for being infected. Indeed, it is safe to continue this labor, it is safe to deliver this baby out of hospital, and it is safe for you to go home after the delivery. So we don't just willy-nilly make these choices here. We're assessing all of the data, and we have some pretty good tools that are evidence-based that help us make these decisions. So it's really a conversation that you want to have with your care provider. Have I said that? Probably 25 times. And again, 25 times I've probably said it is big generalizations here. But you do not have to, your baby isn't going to fall out of your body if your water breaks. You generally have time to make some decisions. You want to be educated on what the water should look like if it were to break. Your water may never break, and that's totally okay. And your water may break at any time throughout your labor. So those are big things to know. What else? I think that covers kind of a lot of it. This comes up a lot. People are really concerned about their water breaking. And when we're laboring with a woman and we hit the 18-hour mark, her water's been broken, there's no spontaneous labor, she is GBS negative, she has no risk factors, we would really like you actively laboring by 24 hours. That's something that we like here at the birth center. So that's sort of what we go by. It depends on where, if we're collaborating with any physicians in the community, what is our transfer of care plan? I mean, there are so many factors that go into what our protocol would be to get you into labor. There are some techniques we use that happen to be very effective. If we have no labor by 18 to 24 hours, we do have a fancy drink that we might give you that seems to work pretty quickly to get labor going if you're really indeed ready to go into labor. So those things we do here. So takeaways from this Fantastic Midwife Monday are: talk to your healthcare provider. What's their protocol if your water breaks before there's labor? Okay. What are you looking for if your water breaks? Is it indeed your water breaking? And know what the risk factors are. What is your GBS status? That's something that you're cultured for at the end of pregnancy between 35 and 37 weeks. We recommend the culture. We'd like to know if you're positive or negative, and it's going to make some, it's going to help us make some decisions on how we monitor you throughout your labor. So there you go. If you have any questions, as usual, you can email us. You can contact us here on this Facebook page. Like us on Instagram. check out our website, scdbirthcenter.com, and we're happy to answer any questions. I hope you guys are having a great day, and enjoy this Monday, enjoy the rest of your week, and we'll see you soon. I may not be here next week. I'm going on vacation. So we'll figure out what's happening then. Okay, bye everybody.